Hello, good morning, good afternoon, good evening to wherever you are joining us from around the world. It's fantastic to have you here and taking part in this live and interactive webinar from Biogal Labs. My name is Jessica Case. I'm the manager of Complete Veterinary Care. We are the UK distributors for Biogal. And I'm speaking to you from what feels like the 437th week of lockdown here in London. The restaurants are closed, the cinemas are closed, the pubs are closed, the gyms are closed. So I, for one, am very grateful to at least be able to keep my mind active over the next hour or so as we learn about treating FIP from the wonderful Dr. Diane Addy. Before I introduce Dr. Diane, a few things to mention. I can see you all are starting to join and say hello in the chat. Welcome, it's great to have you all here. For those of you who are joining us from Turkey, we do have a live translation. We have a translator available. You should be able to see a button on the bottom of your screen that says interpretation. If you click on that, you'll see options come up for a number of different languages. If you select Turkish, then we have a live translator who will be translating as we go through today's session. Another thing to mention is you will see the chat, which I can see that you are all on now and saying hello. Welcome, everybody. It's great to have you all. Can I ask that while we are going through today's session, if you have any questions that you would like to be answered, that you add them to the Q&A box and not into the chat box. You should be able to see a Q&A button on the bottom of your screen. Any questions that you have about today's session, if you can add those into the Q&A box and not into the chat box, then we will look at those questions and do our best to answer them. We should have some time at the end of today's session for Dr. Addy to answer some of the questions. There won't be time to answer all of them, but don't panic if your question is not answered by the end of today. Biogal will be making a note of the questions that go into the Q&A box during today's session and passing these on to Dr. Addy, who will be answering them all. And once she's had time to go through those answers and to write them all down, Biogal will be sending out a link to the recording of today's webinar, as well as the answers to the questions that have been put into the Q&A box. So all questions into the Q&A box and not into the chat box, please. And for those who are joining from Turkey, there is live translation available if you click on the interpretation button at the bottom of your screen. Okay, we should hopefully have everyone logged on and signed up. So it's my pleasure to introduce Dr. Diane Addy. Diane Addy is a veterinary biologist whose PhD and main focus of research is on feline coronavirus and feline infectious peritonitis. She is a former senior lecturer and head of diagnostic virology at the University of Glasgow Veterinary School and a member of the European Advisory Board of Cat Disease. She is the author of the catvirus.com website and has channels on YouTube and BitChute. Her dream is to eradicate feline coronavirus and therefore FIP. So I will be handing over to Dr. Diane, who will be sharing her screen and taking us through today's session on treating FIP. One more reminder to please add your questions into the Q&A box at the bottom of the screen, and to everyone that's joining from Turkey to click on the interpretation button where you can find live Turkish translation as we go through today's session. So Dr. Diane, I will hand over to you.
Thank you very much, Jessica. Welcome to this webinar and thank you very much for attending. These are 4 cats who came to my online practice with their guardians seeking advice about FIP treatment. My question to you is which of these cats you would treat for FIP. Skywise and Frank both presented with uveitis, and you can see their keratic precipitates in the red circles. Basil was an 11.5-month-old British Shorthair cat with ascites, and Logan, a stray cat with high globulins. Jessica, may I have the first poll question, please? So which of these cats would you treat for FIP? Skywise is a pedigree cat, a Norwegian forest cat from a 5-cat household. Frank, a stray Greek cat with uveitis and feline coronavirus antibodies. Basil, an 11.5-month-old British Shorthair with ascites from a 4-cat household. And Logan, a stray cat with high globulins, being looked after by a fosterer. All of them were diagnosed as having FIP by their attending vet. Jessica, have we any results?
Okay, so you should be seeing the question pop up onto your screens, everybody who is logged on. If you could just select your answer, then we will wait until we've had the majority of answers come in, and then we can reveal the answers. I can see we've already had 50% of you answering. You can use the option that's popped up onto your screen. I can see those answers are coming in, so we'll just wait and give everyone a bit more time to answer, and then Dr. Diane will discuss the answer. We're on 60%. Okay, I think we'll reveal the answer now. We've had plenty of answers coming in, and that should be popping up onto your screen. There we go.
Oh, that's interesting. Thank you, Jessica. So you all, well, mostly you got it right. You chose Basil. I'm sorry, I haven't memorized the results. There we go. Ah, some of you chose Frank and Skywise and Logan. It's like a popularity contest, isn't it, a bit? Thank you for showing me that. I'm trying to make the slide go to the next slide now, but it doesn't seem to want to. There we go. So in fact, the real answers were Skywise and Basil. So it's really impossible for you to tell. This was a bit of a trick question, but the point to make was that it's very difficult to distinguish FIP from other conditions, and it's very easy to misdiagnose it. Frank had toxoplasmosis, and he was cured with 1 month of clindamycin. And toxoplasmosis is one of the most commonly mistaken misdiagnosis for FIP. And here is Frank after his course of clindamycin. He was a Greek cat being exported to Australia. So here he is, alive and well, 2 years on. I was sent that photo for Christmas. Logan was the stray cat, and stray cats rarely have FIP, but you probably were thinking that he's being in a multi-cat foster situation, possibly. And Tabitha was really wonderful. She approached me, she wanted to do the treatment despite their attending vet advising euthanasia. And I advised a dental and cutting his claws, obviously. She told me that she had fostered over 100 cats and successfully rehomed them. And Logan was the first cat that she'd failed with, because she kept him. Here he is sitting on her knee in front of the fire. So happy ending for poor wee Logan. So the first key message of this webinar is to get the correct diagnosis. As Professor Mike Willard once said, a wrong diagnosis can be far more devastating than no diagnosis. And the proportion that I've shown you just now is reflective of the real proportions that come to my online consultation practice. about 40% of the cats turn out not to have FIP, but to have some other condition. So let's look at the details of Skywise. And to get the correct diagnosis, the days of needing to do a biopsy are past. You will need to do biopsy post-mortem if it's a litigation situation. For example, somebody who's bought a pedigree kitten who develops FIP and dies. But for treatment purposes, if the cat has effusive FIP, you can more or less confirm it by RT-PCR on the effusion. And for non-effusive FIP, dry FIP, which was Skywise's case, you can confirm that by coronavirus RT-PCR on an ultrasound-guided fine needle aspirate of the mesenteric lymph node. And we published that in the Journal of Feline Medicine and Surgery. Don Dunbar was the lead author. So we published Skywise case, which is open access, thanks to the generous donors at GoFundMe who have paid for the publication fees. It's on viruses. It's free to download if you would like to read his case in detail. The second key message is not to use systemic corticosteroids. And I have done a 180-degree turn over the last 3 or 4 years, partly influenced by this paper of Hugo and Heading, where their case survived 787 days, which is remarkable. I was also influenced by Professor Legendre's paper on polyprenal immunostimulant, which you'll know as Vetimune. This is a graph from his publication, and on the x-axis you'll see the survival of the patients in days, and on the y-axis the surviving fraction. This is a survival curve or a Kaplan-Meier curve. The blue line is the statistics of the cats that were treated with Vetimune without corticosteroids. And when the steps go down, it means a cat has died. The red line is the polyprenal immunostimulants with corticosteroids. And by any route, they mean either systemically or topically. So you can see that the cats without corticosteroids survived longer than the cats that were treated with corticosteroids. This is the next graph from that publication, and it's comparing polyprenal along with systemic corticosteroids in blue this time, and ocular corticosteroids in red. And you can see that the cats that were only given corticosteroid eye drops were more likely to survive than the ones that were given systemic corticosteroids. Therefore, for Skywise, I immediately recommended that the attending vet stop the oral prednisolone, and Mark gave topical prednisolone acetate ointment instead. And you can see the huge success. On the left is Skywise's eye in April, and in June he had regained his sight and he was completely healed. So I'll cut to the chase, and spoiler alert, which treatment is best? It's Mutian pills. And we follow that with Verbigin Omega given by mouth. The doses are 1 Mutian 200 per 2 kilograms body weight each 24 hours, and you can divide that into 2 doses. For cats with intraocular signs, they need 1.5 Mutian 200 pills per 2 kilograms body weight. I would say until resolution of clinical signs, and then go back to only 1 pill per day. This may be different from what Mutian people are saying. I'm still gathering information, observational information on patients being treated in the field. For neurological signs, we need to get penetration across the blood-brain barrier, and that requires 2 Mutian 200 per 2 kilograms body weight until resolution of clinical signs, or until alpha-1 acylglycoprotein normalizes on 2 consecutive tests. And I'm aware that you're not all able to obtain that. And if you can't, then 12 weeks is what the Mutian people recommend. What are the side effects of Mutian pills? Well, I'll talk more about that later, but cats will vomit with pills. They're great vomiters. So also you want to protect their esophagus by giving a bolus of food afterwards. With any kind of nucleoside adenosine analog, I said that wrong, adenosine nucleoside analog, you want to protect the liver with S-adenosyl L-methionine, in other words, denamarin or hepatocel, to protect the liver. And there's also concern about renotoxicity with these nucleoside analogs. So I would advise monitoring SDMA. The Mutian people indicate that Mutian pills are contraindicated for cats in iris stage 3 of kidney disease or with very severe liver disease. I recommend treatment support, for example, vitamin B12, either injections weekly or Protexin Cobalaplex, which is a veterinary preparation for cats. The vitamin B12 serves three purposes. It is an appetite stimulant, it is anti-inflammatory, and it supports red blood cell production because, of course, the cats with FIP are highly prone to the non-regenerative anemia of chronic inflammation. I've already mentioned supplementing with same. Nutrition is important. Cats are obligate carnivores. Therefore, they need arginine. It's an essential amino acid for cats, unlike in humans. So they need perhaps a tablespoon of real meat every day in order to obtain enough arginine. It's a good idea to supplement with omega-3 oil, for example, in salmon, which also counteracts inflammation. If the cat is anorexic, then give mirtazapine. We will also talk about erythropoietin if the cat has a non-regenerative anemia that's very severe, and polyprenol immunostimulant if the cat is lymphopenic. And we'll talk on later about the duration of treatment in regard to normal alpha-1 acylglycoprotein, or 12 weeks if that's not available. I follow the Mutian pill course with Verbigin Omega at 100,000 units per cat per day by mouth. Now, I know that Verbigin Omega comes in vials for injections, but you can dilute that and use it orally. There are papers published about this. It's not unusual. And on www.catvirus.com, there's a free download of how you actually go about diluting it to get 100,000 units per day. And the duration of that treatment is until the feline coronavirus antibody titer reduces significantly. I recommend that you take fecal samples from the patient before you treat, and then from the in-contact cats for coronavirus RT-PCR testing. The reasons for that are, first, to check whether the antiviral that you are using works against the virus infecting your patient. I've not had a problem with that with Mutian pills, but it's worth doing. And then secondly, to find out if there is a risk of the in-contact cats reinfecting your patient, because I'm unclear at this stage how often people think their cat is having a relapse of FIP, whereas in fact the cat might be reinfected. I don't know, but I take the precaution when cats come to the online practice of clearing the in-contact cats of virus. Skywise lived with 4 other cats, and these are their feline coronavirus reverse transcriptase quantitative PCR results on day 7 and day 41. And Skywise had already had a Mutian pill before he was tested. And one of the ways that RT-PCR can be reported is the CT result, that stands for the cycle threshold. So you can see the CT results at day 7 for Skywise, Paddy, Oliver, Link, and Zelda. And Skywise had CT of 30, which is actually a low reading. CTs are counterintuitive in that the higher the amount of virus, the lower the CT. And the in-contact cats who were infected were given 5 days of Mutian pills, and you can see that on day 41 post-diagnosis, all the cats were negative in their feces. So the virus was out of that household. We're going to talk now about monitoring weight. And I've made a film of this. It's on BitChute and YouTube. And you can see in a bit more detail. Here is Skywise looking like a poor wee soul on the scales. In his paper on GS 441524, Professor Peterson said that the simplest long-term measure of treatment efficacy was body weight. And the paper went on to say that weight gains of 20 to 120% occurred during and following treatment, even in cats 1 year of age or older. In other words, in cats that had already achieved adulthood. I wanted to define this a little bit so that people would know prospectively going forward how much weight gain to expect from their cats. So what we do is weigh the cats every day or every week, and then take the average weight for that cat. And what we find is that during Mutian pill, but not injection treatment, the cat will gain about 25 grams or an ounce a day average. But effusive cases initially may appear to lose weight as the effusion resolves. And then when they're put onto Verbigen Omega treatment, they gain weight at about half that rate, at about half an ounce a day or 10 grams. So here is Skywise on the scales. And Joanna, his guardian, was really good at sending me his weights, and we'd celebrate together every time he passed a milestone. Here he's gained a whole kilogram. And I would plot his weights against the dates on an Excel file. And here is a graph that I made of it that was published in the viruses paper case report. You can see he had a vaccine booster, and that seemed to trigger his FIP, but he was already losing weight. We think that when the younger cats were introduced in January of last year, they brought the virus in. So even though he's 5 years old, there was a source of coronavirus infection for him to have developed FIP. And there was also the stress of the vaccine in his history. And getting the history of the cat is very important. So you can see that he was losing weight. Oh, sorry, I've forgotten to explain the graph. The weight is in kilos on the y-axis and the days post-diagnosis on the x-axis, counting day 0 as the day he was diagnosed last April. So you can see that he was losing weight considerably before he was diagnosed. And that was about 22 grams a day of weight loss. When prednisolone was begun, his weight loss slowed to 2.5 grams a day, but he was still losing weight. And then Mutian pills were begun, and he began to gain weight at 22.6 grams a day. And then after 50 days on Mutian, he was on Verbigen Omega and gained 8.6 grams of weight per day. This is Noldor with effusive FIP. And thanks to David for the photo of Noldor. He was losing 10 grams a day when effusive FIP was developing, and that worsened to 42 grams a day while he was on prednisolone. Then I got involved and said, please stop the prednisolone. He was put onto Mutian instead, gained nearly 30 grams a day, and then on interferon omega, he gained nearly 17 grams a day on average. And you find that the cat's weight levels out. He's weighing regularly now about just under 6.5 kilograms. So it's really important not to use prednisolone or systemic corticosteroids, except for palliative reasons, for a cat where all hope is gone and lost. If you're unable to obtain Mutian, then use meloxicam rather than steroids. And that's what I was doing with meloxicam, Verbigin Omega, plus or minus polyprenal immunostimulant before the anti-coronavirals came along. I'd like to talk about Jasper here, and there he is at the back, and how weighing him saved his life. He had a very conscientious vet who would weigh him every year when his booster vaccine was given. And then in 2019, they realized that he'd lost 600 grams. Now, over a period of 1 year, 600 grams isn't that much. And at the time it was put down to a change of food. But luckily the vet had noted all that and had remarked on it, so that when he continued to lose weight, his guardians became aware of that and brought him back to the surgery. He was investigated, he was found to have FIP, and then he was given treatment and he recovered. So you can see that the subclinical non-effusive FIP had lasted for over 14 months in this case. So this emphasizes the importance of weighing the cat regularly, and it doesn't cost anything. So I'd like to talk a little bit about weight and how it can pick up secondary diseases. Also, this is B, and thanks to Tanya for these photos. B has her effusion building, and you can see her weight increasing. But then her weight began to decrease before the Mutian was started to be given, as shown by the red arrow. And then her weight, it began to decrease quite rapidly, presumably as the effusion is resolving. And you can see her here at day 3 of Mutian, how much effusion had resolved. And here she is at day 14, where her body condition score is just slightly under optimal. And so I'd like to zoom in, on this part of the graph here. Her weight seemed to be going up no problem, but then it suddenly went down, and it turned out that she was vomiting. So I suspected that she had a trichobezoar, a fur ball, and I advised Royal Canin aging dry food. And I'm grateful to Monique Trottier for alerting me to this food. I didn't know about it before. And I've actually found that it's better than the Royal Canin hairball for controlling trichobezoars. So I use it all the time, just a tablespoon a day per cat of this dry food. I wouldn't recommend using it exclusively because it is a cereal-based food, but it's wonderful at controlling furball. So you can see that after her furball problem got resolved, her weight just took off. And at the moment she's leveling out and finding her optimal weight. And you find that the cats eventually do that. They find a weight that seems to be comfortable for them. How else do we monitor treatment? Well, if the markers of FIP are clinical signs, raised alpha-1 acid glycoprotein, non-regenerative anemia, lymphopenia, hypergammaglobulinemia, raised bilirubin, and a very high coronavirus antibody titer, then markers of recovery are going to be the opposite of that. So resolution of clinical signs you've already seen. Here's Skywise before and after treatment. Here he is with his cheeky look, having requisitioned a cardboard box. I don't know what it is with cats and cardboard boxes. He'd fully regained his vision, and you can see he'd regained his condition from being the poor little soul on the left. So his uveitis resolved. This is an ongoing case at the present, thanks to Christina for the photos. And the eye that you can see on the left had lost all vision, and with the Mutian pills on the right, the kitten, or the young cat rather, is now following movement. So we're hoping for a miracle of recovery for that little cat. You've seen how B's effusion resolved. So resolution of clinical signs is an obvious marker for recovery from FIP. If the clinical signs aren't resolving, then you need to question the diagnosis. I would like to talk now about alpha-1 acid glycoprotein, and this is work that I haven't yet published, but hope to do so in future. Consistent reduction of alpha-1 acid glycoprotein levels to normal levels of up to 500 micrograms per mil is, in my view, the single best marker for recovery from FIP. And look for 2 consecutive normal levels a week apart. AGP is an acute phase protein, so it rises within hours of an infection or of inflammation or trauma. And it also reduces very quickly in the face of resolution of the clinical signs. I'll jump about a little bit with the items on this slide. Normal globulin is slower to respond than AGP. This is Skywise's globulin level in purple. The normal level at 45 grams per liter is the red dashed line. And you can see his globulins coming back down towards normal, but taking a long time to do so. And the colored lines indicate which treatment he was on at each time. So you can see the interferon omega in the green line. His globulin levels didn't return to normal until he was well within the Verbagen omega oral treatment part of his treatment. Markers like total protein and albumin globulin ratio are useful in terms of globulin. And the albumin globulin ratio here is shown in red, again with the treatments along the bottom in different colors. An albumin to globulin ratio of greater than 0.8 rules out a diagnosis of FIP. And we were very happy when Skywise's results got to that level. But as you can see, he was some months into treatment before they did. When you're worried about the possible toxic effects of using anti-coronavirus drugs, you really don't want to have the cats on these kinds of treatments for very long term. And I get some rather scary emails from time to time from people who have used things that they've bought online that haven't worked, and so they've used one after another on their cats for months on end, which is really very sad. The albumin to globulin ratio, just a quick reminder, I know you know this, it's the albumin divided by the globulin. And sometimes vets say to me, but Diane, my machine doesn't give me a globulin result, but a sort of quick way to calculate it is to take the albumin from the total protein, and that gives you a rough idea of the globulins, so you can work out the ratio from that. Remember that cats that have colonic FIP, for example, may have very low albumin globulin levels, may have very low albumin because they're losing the albumin from their gut, and that will skew the albumin to globulin ratio. This is one such case. This is Mike, who had colonic FIP, and we were treating him for 6 months with feline interferon omega, polyprenal immunostimulant, and meloxicam. He's still on those treatments some 2 years later. The black line with the black dots is his globulins, and you can see that, it's his albumin globulin ratio, and you can see that it didn't come up until after he was on 12 weeks of injectable GS441524, and that was briefly available from DC Chemicals and no longer is. But he kept on shedding virus in his feces. It didn't eradicate virus shedding. And Mike's guardian said, Mike's skin has really taken a beating. He has bumps all over his body where the injection sites are. we've talked a bit about Skywise. I'd like to move over to Basil now, who's the other cat, the one that the majority of you rightly believed had FIP. This is the FIP diagnosis algorithm, which is a free download from the catvirus.com website. And on this, on the right side, I've made a little table of approximate probabilities of a cat with an effusion having FIP based on a paper by Dr. Soma from Japan. So Basil was a British short hair, which means you can rule out this column of domestic cats. And secondly, his age is under a year. So that tells us that he had a 95% probability of having FIP. And this is just a rough guide because you will have to wait while the effusion RT-PCR result comes back. And his effusion was sent off and was positive by RT-PCR. So we were content that he did have FIP. Do not use systemic corticosteroids. That's my second key message here. So we took him off corticosteroids. At that time, Mutian wasn't available. So we were going to go with GC376 and Verbigin Omega, of course, as well as polyprenol immunostimulant and various other supportive treatments. GC376 was first published by Professor Peterson in the Journal of Feline Medicine and Surgery. Basil's attending veterinary surgeon was just amazing, just really excellent. They saved his life and they threw all kinds of treatments at him. I'd like to talk about his hematocrit in particular. So Basil was given polyprenol immunostimulant on day 4, as well as vitamin B12 injections weekly. And he was put on a drip, he was given mirtazapine, he was given lots of supportive treatment. When I got involved, at the time I'd been looking at itraconazole as a possible treatment. I do not recommend that now. The cats lose dramatic amounts of weight on it. It doesn't stop them shedding virus and it doesn't cure their FIP. So I would very much be against using itraconazole in FIP. But at that stage, he got onto that and meloxicam at day 5. The Verbigin Omega arrived at day 12. And you can see that his hematocrit, which is shown in the red line, was falling dramatically and got to a very worrying stage about 12 days in. And at that stage, his attending vets wanted to do a blood transfusion. And I pleaded with them, please don't do that, because I had seen records of both Rolly and Luca who had dry FIP and profound anemia, and they had both died within hours of a transfusion despite being blood type match. They were both blood group B, and despite that, they went into shock hemolytic anemia and had to be euthanized. So I said, please use darbepoetin instead to stimulate his red blood cell production. And he was given that on day 14, and his hematocrit did go up. And then the GC376 arrived on day 17. And despite him feeling a bit better in himself, his red blood cell pattern continued to wave around, going down again, which was very worrying. It makes you then think, well, is our treatment not working? What's going on with this cat? I'll just take away the extraneous things for a moment. I felt that I had seen that pattern somewhere before. And my question to you, Jessica Q poll question, is have you seen it before? And is it typical of, for example, feline leukemia virus, FIP itself, infectious anemia, or chronic kidney disease, or something else? Please, Jessica, can you launch the poll question?
Okay, we should get the poll question popping up onto screens again. There we go. So everybody should have the opportunity to select their answer. We'll give some time for the answer to come in, and then we can reveal what everyone has voted, and Dr. Addy can discuss the answers. Thank you to everyone that's taking part. We've got lots of questions coming in. You can see that we've had 30% of you answer the question that's come up on the screen. Lots of chat and questions coming in. It's great to have you all taking part. We will do our best to answer some of them at the end of today's session. If we're not able to, then we will be sending out a link to the questions and answers at a later date. We've got 50% of the answers coming in. So you should be able to select your answer. And once you've got enough, then we will discuss what's come up. Okay, I think we've had enough answers, so we should be able to see the answers coming onto screen now. There we go.
Oh, that's so interesting. But the winner is feline infectious anemia. Thank you, Jessica. And that is the correct answer. That's very interesting. This shows a regenerative anemia. And in FIP, we have a non-regenerative anemia. So it was partly regenerative. Sorry, it doesn't seem to want to go to the next slide. I'm not quite sure. My computer seems to have frozen a little bit with that. So what this reminded me of was a graph that I had seen published by Feline Tasker, where she showed the hematocrit, or the packed cell volume, going up and down in this wavy way with a 7 to 10 day interval, corresponding to when hemotropic mycoplasma parasitemia is at its worst. I'm not quite sure. Yotam, have you any advice about what I should do to try to unstick my computer? It seems not to like the poll questions.
Bit of technical trouble here. It might be worth trying to share your screen again, Dr. Addy.
I'll stop and then I'll share again. Thank you for that advice, Jessica.
No problem. Is that working now?
No, I'm afraid not. Oh dear.
Oh, we can see your mouse moving.
Oh, right. Okay, well, have I stopped the screen share?
Yeah, the screen share stopped now.
I'll move it to the next slide and then see if that works.
Okay.
Very sorry about this, everybody.
Got lots of questions that are still coming in on the chat and the Q&A box. Thank you everyone for your questions. We will do our best to answer some of them at the end of today's session. Otherwise, Dr. Addy will go through and provide the answers at a later date. Biogal will be emailing out a link to all of those questions, as well as the recording of this webinar and the slides that you're seeing on your screen. That seems to be working now, Dr. Addy. Is that okay?
That's wonderful. Thank you very much, Jessica.
No problem.
You're a lifesaver. So, so on the bottom is the graph that Basil's results reminded me of. It's a figure from Feline Tasker's paper in the Journal of Clinical Microbiology. And you can see the gray line was the hematocrit of the cats in their experiment. And the black line is the number of the PCR number, copy number of the parasites in the blood. So I was going to ask a second poll question of how to treat it, but given that I've jammed both times, I think I might just ask you to answer it in your own head for a moment. Is it amoxicillin clavulanic acid, doxycycline, pradofloxacin, or clindamycin? So I hope you've all answered it to yourself. The answers are both doxycycline or pradofloxacin. And he was given doxycycline on day 1, and his hematocrit was like this thereafter. So you can see that he had been co-infected with feline infectious peritonitis and feline infectious anemia, and required the doxycycline in addition to all his other treatments in order to recover. His weight also turned around when we treated the secondary disease. And that brings me to the subject of secondary diseases, which I do see in some of the cases of FIP. Most commonly, hemotropic mycoplasmas, and some animals are co-infected with toxoplasmosis and require clindamycin as well as the FIP treatment. Presumably, latent toxoplasma becomes active when the cat is immunosuppressed with FIP. If they have herpes virus, and most cats do have latent herpes virus, that may manifest as sneezing or conjunctivitis. You've already seen B and her fur balls. And I don't know if this is related or not, but some cats are like Buddy here and develop acne, and happily it responds to saltwater bathing. It's a mystery. It may simply be coincidence. I don't know why that would occur with FIP. I also have no idea why trichobezoar would occur. That's something that baffles me. If any of you have any ideas, please let me know in the comment section. So we're seeing secondary diseases because coronavirus infected monocytes attack the lymphocytes. And we see this in SARS-CoV-2 infection as well. People with COVID-19 are also lymphopenic. And therefore cats with FIP often have some other secondary condition. So we'll now look at Basil's lymphocyte count on the y-axis here and days post-diagnosis on the x-axis. And Basil's vets had gone in on day 4 with polyprenyl immunostimulant. And I remembered that Dr. Legendre's paper was on dry FIP. So I came along and said, oh, Basil has effusive FIP. He doesn't need immunostimulants. Well, all I've got to say about that, since his lymphocyte count then plummeted, is, oh, I felt properly stupid. So then I went back and looked at some of my records for cats that had polyprenyl immunostimulant and were lymphopenic. So these are 5 of the cats here, they're not including Basil, and 5 of the cats given PI on day 0 or month 0 rather in this graph, then had their lymphocyte count go up. There was reversal of their lymphopenia, except for poor wee Kiki in the turquoise line. And Kiki's the one cat that we've lost since the anti-coronaviral drugs have become widely available. And she was on Mutian injection, and she went on to develop neurological signs. Now, in Professor Peterson's GC376 paper, only 6 of the 26 cats recovered, and the most common form of relapse was neurological signs. And the reason for this is the anti-coronavirus drug not crossing the blood-brain barrier. Fluid builds up in the brain. In fact, the cats get hydrocephalus. And Jacques Penderis published that hydrocephalus in an adult cat was most commonly caused by FIP. And I'd like to talk to you about a cat called Kitten 2, who was being treated for FIP with Mutian pills. And this is kitten 2's alpha-1 acylglycoprotein level. It had got down below 1,000, and unfortunately, the mutation was stopped at 8 weeks. And the kitten then developed the same sort of signs as Kiki did, in other words, a painful tail. Now, because our internet connection where I live isn't good enough, I can't show you the films of Kiki and kitten 2 to show you how the painful tail manifests. But I will be uploading a video of this onto BitChute and then eventually YouTube. I'm trying to boycott YouTube because of their censorship, of which I do not approve. So you will be able to see these two cats at some point quite soon. And the painful tail is a bit similar to a cat coming into heat. You know how they hold their tail rather peculiarly round to the side. So it's important to differentiate that. But very rapidly, these cats go on to develop ataxia and then seizures. And kitten 2 did that. Her guardian started the mutation again at double dose to get into the brain, and then didn't stop the mutation until after the AGP level had reduced down to below 500, which is shown by the red dotted line here. That's normal. That's the normal level. So you stop the mutation pills when you have 2 consecutive AGP results. Oh, sorry. I knew there was something I wanted to say there. Kitten 2 is still alive and well. She made a full recovery. And another area that I used to be wrong in, there are quite a few of these you'll find, is that we used to always recommend that if a cat had neurological signs, they were euthanized. Whereas nowadays, we're seeing an amazing number of them come back from ataxia and even seizures. It's just amazing. So stop the mutation pills when you have 2 consecutive AGP results that are normal, or at 12 weeks, which is what the manufacturer recommends. And the manufacturer said to me that they wouldn't honor the guarantee that they give if the cat had stopped mutation early. And when, in my cases, what we do is we stop the mutation and begin the oral Verbigen Omega. And people say, well, when can I stop that? And at the present moment, I'm saying when the coronavirus antibody titer reduces significantly, then that will take months. That will be quite slow. And I haven't yet found another better marker for that. It may not be necessary, but given that we've had no relapses, I don't want to stop it. This was to be another poll question, but again, I'd rather press on if you don't mind, because we're getting on in time. So this cat had been on GS injections and then mutation pills the year before. And then he presented to actually a feline specialist who said that the FIP had stayed latent in his kidneys, which it had not. So you can see that this was not FIP because his globulins are normal. Okay, so that's not a guarantee, but amongst everything else, he was obviously not a cat with FIP. He was obviously a cat in chronic kidney disease, and he had fluctuating anemia, which was partially treated by pradifloxacin, but he had the non-regenerative anemia of chronic kidney disease. And sadly, even despite some response to Forticor, he did succumb. So renotoxicity is a worry with some of these drugs. I've seen it in 2 cats of 4 on mutation, 1 cat on aura, which is a sort of, I believe, is a knockdown, what's the word, an imitation of mutation. And that cat's SDMA rose alarmingly within the first month of treatment. So even though it's, I believe, cheaper, it's not safe. And 1 cat, only 1 cat on GS 441524, but I only have records for 1 cat, only IDEX measures SDMA, I believe. So I don't have very many SDMA statistics to share with you. Hopefully I will get some knowledge of that as time goes on. In Professor Pedersen's paper on GS 441524, he noted that the side effects were severe inflammatory reactions, and they're weepy and they're really quite nasty. You heard about Mike's parents saying that he had his skin had taken quite a beating, and they're weepy and really painful. It's not nice. And of course, it's a risk for injection site sarcoma. Mike didn't stop virus shedding in his feces. And we know that remdesivir doesn't have great penetration of the lungs in human beings with COVID-19. So they seem to get a sort of resurgence, the humans do. And some prominent human microbiologists are worried that remdesivir, which is the precursor of GS 441524, may be a mutagen. And so there may be relapses. So I'd like to talk about relapses versus reinfection and other diseases. They're very easy to confuse. And this is Basil when he'd recovered, and the 3 other cats were in the household. He had been separated from them because they were worried that he would infect the others. But when the others were tested, they're Bentley, Ashley and Natasha, both Bentley and Ashley were found to be shedding virus in their feces, and they were given Mutian for 7 days, and they were part of the study that was reported in Research in Veterinary Science. And once again, I'm grateful to the cat virus donors and the GoFundMe donors who paid the publication fees for that paper. So it's open there for you all to read. This is these are figures from that paper, and it's showing you the virus shedding of cats going on from weeks, days, and weeks before they were given Mutian. And the top graph is to show you that if you give too little Mutian, there's a danger of the cats continuing to shed virus, not properly eliminating it. Whereas on the bottom graph, you can see that the virus shedding just stopped within days. It was really quite dramatic. And 29 cats were cleared in that study, and they're still negative. So you already saw that Skywise's other housemates were cleared, and here is Skywise with those housemates. But the question that the reviewers of my paper rightly said was, is that just clearing virus from the gut? Or, well, I put that the wrong way around. I claimed it was preventing FIP, and the reviewers said, Diane, you're absolutely wrong. You haven't proven anything of the sort. So in order to do that, we need to follow these cats for a long time to see whether it's cleared virus from the whole body or just from the gut. And this is Oliver, who was one of the housemates of Skywise. And he presented with back pain in November 2020. And actually his study will be published as a blog, thanks to Biogal agreeing to publish it. And so I went into the post-FIP, post-traumatic stress disorder syndrome. I went, oh, back pain, even though it was in his lumbar region and not his tail region. And Mark kept his head, thank goodness, and said, well, look, this is probably a new condition. And he just treated Oliver symptomatically. And what we did was measure his coronavirus antibody titer, which had been over 10,000 in April last year and had fallen to 40 in November. And that conclusively showed that he was not a relapsing FIP, or that FIP hadn't incubated all that time and then reared its ugly head in November. So a low or negative coronavirus antibody titer can help you rule out FIP, provided the test is sensitive enough. And I'd like to point you to our paper back in the Journal of Feline Medicine and Surgery, published in 2015, where the coronavirus immunocomb came out as the most sensitive test with 100% sensitivity. So Joanna, who was Skywise's guardian, was so pleased with that result for Oliver that she then antibody tested all the rest of the cats. And you can see that their antibody titers were falling significantly as well. And we brought Skywise off interferon omega, but then his herpes virus popped up, so we had to put him back on it. So a reducing antibody titer is really very useful. And I would advise you take the first antibody titer somewhere early in infection, but then don't bother to do it again until every 2, 3, 4 months, because it won't change very quickly. Often they're so high that they take many months to decrease. And here is a graph of the antibody titers of Basil's housemates. Basil in blue, Bentley in brown, Ashley in green, and Natasha in purple. And you can see that 10 months on, they had decreased quite well, except for Basil's. And so this is Basil, Ashley, Natasha, and Bentley all back together again, and they all lived happily ever after. So the word laboratory is made up of labor and oratory. I've been doing a lot of I've been doing a lot of oratory. Here are the people that did all the labor, all the heavy lifting. It was Niels Peterson who discovered that adenosine nucleoside analogues could cure FIP. It wasn't me. It was Tony Zhu and colleagues in China who invented Mutian pills, and Cheryl Curran, the English cat breeder, who introduced me to Mutian pills. So huge thanks to them. Huge thanks to the innumerable cat guardians and their veterinary surgeons who over the years have made my research possible. And a special shout out to Oz Jarrett for having the courage to take on a kind of mad clinician from the northeast of England. And big thanks to Biogal, the makers of the coronavirus immunocomb, who organized this webinar. Tremendous amount of work behind the scenes. Thank you, Yotam, Jessica, everybody, Ojge for translating into Turkish. Huge thanks to the cat virus donors and subscribers who support me in my work and allow me to be independent and not dependent on any of the products that I've mentioned. And I would be more than happy to take your questions now. Jessica, have you chosen any?
Great, thank you so much, Dr. Adi. That was fantastic. Very, very interesting. Thank you very much for your time. We do have a few questions that we hopefully have some time to answer. As I said before, we can't answer all questions today, but everybody who has added questions into the Q&A section, these will be passed on to Dr. Adi, who will be answering them at a later date. And Biogal will send out a link to these answers once she's had some time to go through them. But some questions to you for now, Dr. Adi. We've had one come through from Kiki Fleerschauvers. Kiki, please forgive me if I didn't say your surname correctly, but Kiki's question is, when I have no access to Mutian, is the combination of NSAID and verbagen omega a good combination?
Thank you for your question, Kiki, and I won't even attempt to pronounce your surname. I would choose meloxicam or loxicam as the non-steroidal anti-inflammatory of choice, and verbagen omega. You saw, along with things like vitamin B12 and all the supportive treatments that I mentioned, and you saw that it maintained Mike for 6 months before Mutian was available. I don't know really of anything else at the moment that you could use. In human beings, there's tremendously exciting work coming out about ivermectin, reducing the mortality of COVID-19 patients. One problem is that you would need 5 times the dose which could be toxic to cats, but that's something to watch out for. And the other thing to watch is Jackie Norris's group in Australia. They looked at mefloquine, and you've probably heard that in humans with SARS-CoV-2, hydroxychloroquine is a possible preventive and therapy because it's an ionophore that allows zinc to get into the cells, and zinc has anti-coronavirus effects. So Jackie Norris and her colleagues have looked at mefloquine and worked out a dosage for that. So I wouldn't recommend that at the moment because it's also possibly toxic, but I hope to be reporting on that in future, and I will talk about it more in my upcoming book. We plug for the book. Watch my catvirus.com website, FIP treatment page for news of that. But yes, for the moment, using meloxicam, Verbigin Omega at 1 million units per kilo subcutaneously every other day in effusive FIP, which is the acute manifestation, and given orally at 100,000 units per day, per cat per day orally. And you can obtain on my website a free download for instructions of how to dilute it to get to 100,000 units per day. And that sort of treatment was reported by Gail et al. It's not me that's thought this up.
Great, thank you. Dr. Addy, could we get you to just end your screen sharing as well?
Yeah.
So that we can see you, that'd be great. While you're doing that, another question from Sylvia Badford. Sylvia says, I just had a 12-month-old kitten get very sick with fever, progressive neurosigns, anemia, globulinemia, stunted growth, suspected FIP, and owners elected euthanasia. There are 2 other cats in the home, a 15-year-old and a littermate from the deceased cat. Should I test the feces of the remaining cats? And if positive, should I do anything proactively? That's
a really great question, but I'm sorry about the kitten that was put to sleep. Yes, do please send feces for looking for virus shedding. Now, virus shedding usually lasts about 2 to 3 months in most cases, so it can end spontaneously, or you can choose to use the Mutian if you prefer to get rid of it within a week. There was something else I wanted to say. But monitor the weights of both of the cats to make sure that none of them is incubating FIP, that after they get rid of the coronavirus, that they will gain weight normally. If they don't, then that's an indicator of something brewing. I hope that answers the question. Oh, I was going to say, make sure the fecal samples don't have cat litter on them because that's inhibitory to PCR tests. And use a really good laboratory such as Veterinary Diagnostic Services in Britain. And I did omit to mention that they receive samples from all over the world, so they can test AGP there if you want. That's the Veterinary Diagnostic Services at the University of Glasgow Vet School. IDEX UK does measure AGP, I think, but it doesn't in all countries. Italy does have good scientists that measure AGP, but I'm aware it's not available everywhere. I'm hoping Biogal will remedy that situation and make an AGP immunocomb.
Okay, well, our next question is actually about the AGP levels as well. There's a question from, this will be the last question for today as well, from Emil Vassaran. Emil says, I don't have access to check AGP levels. What else can we do as a marker for healing? Do you recommend SAA?
Oh, that's a really good question, Emil. Thank you. In the paper that Sue Duthie published initially on AGP testing way back, a long time ago, she did look at SAA and didn't find it as useful. But if that's what you've got available, then it might be worth looking at. In humans and dogs, C-reactive protein is monitored as a measure of treatment efficacy. I'm not sure if that would be useful in FIP cats. I haven't looked at that, but that's a good question. I hope that you'll look at that and maybe give me some feedback. Thank you, Emil.
Great. Okay, well, I think that's everything that we have time for today. So thank you so much, Dr. Adi. That was fantastic. Thank you very much for your time. And thank you so much to everybody that has taken part in today's webinar. It's been great to have you all taking part in all of this and sending in all of your questions. One more time, I will say that if your question hasn't been answered today, don't worry, your question will be put to Dr. Adi, who will be taking some time to answer the questions that have been put in the Q&A box. Biogal will be sending out a link to this recording, to the slides that Dr. Adi used, and she will be answering the questions. All of this will be sent to you as a link later on. So thank you very much, Dr. Adi. Thank you very much, everybody, for taking part. It's been great to have you all here, and we will see you next time.
Thank you very much, Jessica.
Thank you. Bye-bye.